Completing the Oral Hygiene Care Plan, Series 7. Ideally, all residents in long-term care should have a complete oral health examination by a qualified oral health professional upon admission and then on a regular basis thereafter. Best practice indicates that these examinations should be supplemented with oral health assessments and screenings by trained caregivers using validated tools, preferably those created for use with frail older adults and those with functional and cognitive challenges. OHAT, or Oral Health Assessment Tool. The Oral Health Assessment Tool was featured in the RNAO Nursing Best Practice Guideline Oral Health Nursing Assessment and Interventions 2008. This tool guides the assessor through a number of categories in order to ensure a comprehensive assessment is conducted. It also provides guidance with regard to the action required when changes are observed. It is recommended that an oral hygiene care plan be developed concurrent with the completion of the oral health assessment. The OHAT can provide some of the baseline information required for the oral hygiene care plan. The follow-up section at the bottom of the OHAT provides a reminder that an oral hygiene care plan needs to be completed. It makes sense then that the two tools should be used together. Ideally, the assessor should not be the same person that provides the daily oral care. There is value in having a different care person doing the OHAT and developing the oral hygiene care plan. That second set of eyes will often observe things through a different lens, and those observations lead to fruitful discussion and optimal care planning. This oral hygiene care plan was adapted from Chalmers' 2004 validated instrument. The top left, or assessment section, can be completed using information collected during the oral health assessment, but it is recommended that the two be completed concurrently since the oral hygiene care plan collects more specific information. The top right, or interventions area, may require some input from a dental professional and will most certainly draw on knowledge provided by the resident's daily care providers, so that the assessor may not be able to complete the entire form during the oral health assessment, but may have to finish up later once there's time for further consultation. The lower portion of the plan, outlining the barriers, must be completed with input from the caregivers who regularly work with the resident. One of the benefits of working through a comprehensive oral hygiene care plan is that it encourages both assessors and caregivers to discuss and problem solve together. A copy of the completed plan can be posted in the resident's bathroom as well as included in the chart. Translating information from the OHAT to the oral hygiene care plan. As each category in the OHAT is reviewed when conducting the assessment, the outcome can serve as an indicator to help develop the oral hygiene care plan. The assessor will need to consider the implications of the Level 1 changes and any recommended interventions to ensure that this information is then translated to the care plan as appropriate. The observations from the first 4 categories of the OHAT, that is lips, tongue, gums and tissues, and saliva, can be translated to the general section diagram of the care plan and or the interventions for oral hygiene care section. The assessment of natural teeth and dentures will be covered in the next slides. Oral cleanliness is another category in the OHAT that will lead the assessor to make recommendations under the interventions for oral hygiene care at that section of the care plan. The dental pain category of the OHAT and the regular barriers in the care plan are intertwined. Dental pain will usually result in responsive behaviors, particularly for residents with dementia. In this slide, the oral hygiene care plan has been superimposed over the OHAT to try to demonstrate the application of the OHAT category findings to the care plan. As an example, the first category in the OHAT is lips. If you had a level 1 finding, that is dry, chapped, or reddened areas at the corners of the mouth, the intervention would be to use lanolin, KY jelly, or other non-petroleum-based lip lubricant. This information would be entered under the Interventions for Oral Hygiene Care section in the upper right under the Other box. If there were splits at the corners of the mouth, you may wish to indicate the specific areas on the diagram under the Assessment of Natural Teeth and Tissues so that caregivers are reminded to monitor for changes. There will be an example provided on slide 13. Tongue. Level 1 finding, that is patchy, fissured, or red-coated, would be information that you may wish to note on the diagram under the Assessment of Natural Teeth and Tissues, as well as under Interventions for Oral Hygiene Care at the top of the middle box. You will tick brush mouth tissues and tongue and indicate both AM and PM. For gums and tissues, brush mouth tissues and tongue, both AM and PM, are pretty much standard procedure. If the assessor notes anything in particular that caregivers should be aware of, it can be recorded on the diagram under the Assessment of Natural Teeth and Tissues. Saliva. Dry, sticky tissues are an indicator that dry mouth products are needed. This is recorded under Interventions for Oral Hygiene Care, indicating that dry mouth products are to be used. The category of natural teeth and the one for dentures are quite simplistic for the OHAT, but you will need to record a bit more information for the care plan under the Assessment of Natural Teeth and Tissues and or Assessment of Dentures. We will look at an example to give you an idea of what this would entail. In this photograph, you see a client with some upper teeth as well as 2 root tips, which are highlighted with the yellow arrows. This information needs to be translated to the Oral Hygiene Care Plan in the upper left section of the tool under Assessment of Natural Teeth and Tissues. Under Upper, the assessor would circle Yes to indicate natural upper teeth and also root tips present. From the OHAT, the assessor would advise a referral to an oral health professional, since the scoring would be at least a level 1. However, there are daily oral care interventions that should be initiated in order to try to improve the condition of the gum tissue. Brush mouth tissues and tongue, AM and PM, would be a standard intervention. When the assessor reviews the OHAT category for dental pain, a consultation with the regular caregiver is required in order to determine what behavior or barriers are encountered with regard to daily oral care. This is critical information to ensure the assessor takes the appropriate steps to ensure the resident is receiving optimal oral care. Assessment of Natural Teeth and Tissues. This slide shows a resident with a single lower tooth and several root tips present. The tooth is undermined by root caries or decay, which makes it very fragile as it could easily break off. Sometimes when teeth break off, they are aspirated, leading to aspiration pneumonia. This would be noted on the diagram of the care plan so that the caregivers are aware that the tooth should be cleaned gently and monitored until it is treated by a dentist. Areas with root tips still need to be cleaned with a soft toothbrush twice a day. As with the previous example, from the OHAT, the assessor would advise a referral since the scoring would be at least a level 1. However, there are daily oral care interventions that should be initiated in order to try to improve the condition of the gum tissue. Brush mouth tissues and tongue, AM and PM, would be the standard intervention. For the OHAT category on dental pain, again, the assessor should consult with the regular caregiver to determine what behavior or barriers are encountered with regard to applying daily oral care. This is critical information to ensure the assessor takes the appropriate steps to ensure the resident is indeed receiving optimal oral care. The diagram under the general section is a particularly valuable tool as it provides an area to record specific concerns such as cuts, canker sores, suspected abscesses, burns, etc. Recording these types of findings will assist daily care providers in monitoring the condition to ensure healing takes place in a timely manner. In this example, the assessor would note under Assessment of Dentures that there is a full upper and a partial lower. When dentures are found sitting in a cup during the day, the assessor should always check with the resident and the caregivers to find out if they are not worn and for what reason. If a resident is losing body weight, they are also likely to be having changes in the mouth, which will affect the fit of the dentures. Often a simple repair or soft reline is all that's required to make them functional, so a referral would be in order. In this case, we will assume that there is no name on either of the dentures, so this would be indicated on the Oral Hygiene Care Plan. Under the interventions for oral hygiene care for the dentures, the assessor would indicate that scrubbing dentures with denture brush both AM and PM is necessary. Also, denture identification is required. Other considerations might be to soak the upper denture in 1 part vinegar and 1 part water to help dissolve the hard deposits. Note, though, that you cannot use this for the lower partial because it has a metal framework. Scrubbing the denture cup and lid weekly with detergent and water is also standard care practice. As mentioned earlier in the presentation, the assessor will need to consult with the care providers who regularly work with the resident to assess the level of assistance required as well as the behaviors. On occasion, the assessor may observe that the state of the resident's mouth is very poor, yet the regular care provider assumes that the resident is continuing to be independent and capable of doing their own care. By reviewing the OHAT findings, the assessor would be able to alert the care provider that a reassessment of the resident's abilities is required. This consultation is also an opportunity to problem solve as regularly observed behaviors are reviewed. Keep in mind that often oral pain can be exhibited through responsive behaviors, so careful intraoral or inner mouth examination is warranted. Again, an indicator that the OHAT and the Oral Hygiene Care Plan are integrally linked. From the review of the behavior and daily care, as well as the results of the oral health assessment, the assessor and the care provider should work together to identify the appropriate interventions for each resident. A soft toothbrush should be advised for everyone, as all residents need to have their mouth tissues cleaned. You don't just brush teeth, you also brush gums, tongue, inside cheeks, as well as the roof and the floor of the mouth. So even full denture wearers need a soft toothbrush. A suction toothbrush is usually recommended for residents with dysphagia or swallowing problems. When toothpaste is used, it should be fluoridated, but there are situations where toothpaste is not recommended, such as for those with swallowing disorders or for a resident with dementia who cannot spit it out. Sometimes small, specialized brushes are recommended by oral health providers. They should also provide specific instructions around their use. Dry mouth products are often needed for residents who are on multiple medications where dry mouth is a side effect. Dentures need to be cleaned using a denture brush. Soaking just isn't enough to remove sticky plaque film. Use denture cleaning paste. Do not use regular toothpaste on dentures as it scratches the acrylic surface, and then that leads to further staining. Acrylic dentures with no metal can be soaked in 1 part white vinegar to 1 part water to help soften hard tartar deposits. Denture cups or boxes must be kept immaculately clean. Dentures should always be identified. There are a wide variety of special care techniques. For more information about these, please review the rest of the presentations in this series. For additional resources, please check some of the following websites that are contained in the next few slides and the articles that are available. Thank you.